Days after the 2020 election, my guest's boss asked one question: how comfortable are you with risk? The answers set the tone for everything that followed. In this conversation, you'll hear how public health advocacy works from the inside, why your emails and phone calls matter more than you think, and what it really takes to talk across the aisle right now. You're listening to the PHEC podcast, episode 453. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and trainings, ultimately helping our clients communicate their health information in plain language to their community partners as well as the broader communities they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building. It just depends upon the needs of the organization. Please reach out to us through our website, drchuntley.com. You'll be able to schedule a time to meet with us, and we'd be really happy to discuss how we might be able to support your organization. Links will be provided in the show notes. I'm very excited to introduce you to my guest on this episode. My guest has spent over 2 decades leading public health advocacy at the national level, and she's the first to say the field has never faced a moment quite like this one. In this episode, we talk about the current public health landscape, including legislative wins, active lawsuits, and the exhausting reality of fighting for science and community health. We also dig into what it means to communicate public health outside of your professional bubble, how the Policy Action Institute is training advocates across the country, and the simple steps anyone can take to make their voice heard. I also have a full episode where I share about my experience at the Policy Action Institute last year, and I'll provide links to that episode in the show notes. Let me formally introduce my guest, and then I'll connect our conversation. Dr. Susan Polan is Associate Executive Director for Public Health Affairs and Advocacy with the American Public Health Association. She oversees the association's Department of Government Relations and Affiliate Affairs, Communications, and Membership. She is responsible for planning and directing APHA's legislative, regulatory, and legal activities, communicating those initiatives and association news to members and the public, as well as overseeing membership recruitment and retention and affiliate caucus and section relations. Prior to joining APHA, Dr. Polan worked as the Director of Government Relations at the Trust for America's Health, a public health advocacy organization. There, she served as lead staff lobbyist to Congress, federal agencies, and the administration on priority issues. Dr. Polan has almost 3 decades of experience in public health, government relations, and associations. She has drafted legislation for Senate consideration on tobacco control and safe and drug-free schools as an American Association for Advancement of Science Congressional Science and Technology Fellow for the Senate Labor and Human Resources Committee. She served as Director of Federal Government Relations at the American Cancer Society and as President and Senior Advisor of Partnership for Prevention, where she represented the nonprofit to government officials, congressional offices, the Congressional Prevention Coalition, and other partners. She has also worked as a health policy consultant whose projects included encouraging an increase in funding for environmental health concerns and grant writing for several health clients. Dr. Polan earned her Bachelor's of Science degree in psychology from the University of Illinois. She later earned a Master of Science degree in health psychology from San Diego State University and a doctorate in social ecology from the University of California, Irvine. Let's connect my conversation with Dr. Polan right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, I am very excited. I say this on every interview, and it's really true. But I'm super excited for my guest today. I feel like you are more of my sister, but you're also my colleague and such a leader in public health. Susan Polan, how are you? Welcome to the podcast.
I'm so glad to be here, Charlotte. It's great to see you, and I'm really looking forward to having a conversation.
Same. We have so many things to talk about. Let's start with an introduction. Take a moment, introduce yourself, tell us, a little bit about what you do.
So my name's Susan Polan. I am the Associate Executive Director for Public Affairs and Advocacy at the American Public Health Association. And I've been with APHA for just over 21 years. And what I do in a nutshell is really figure out how to make sure that people understand what public health is and who our members are, and try and get information to our members, try and get the general public to engage and understand what public health is, try and make sure that we have partners and that we communicate and advocate to make sure that there is nobody who can say that they have not heard about or from public health in some way, shape, or form.
That's a lot to be responsible for. Oh my gosh.
I haven't even gotten started.
Oh my gosh. Yes, that's such important work. I think that for our listeners who are familiar with part of the American Public Health Association, you likely know who Susan is. And some of you may not know of Susan because a lot of what you do, I feel like, blends into the background quite often. But I love that we have this chance to chat a little bit. Before we dive into too much of right now, because we're going to have a lot to talk about there, let's roll back a little bit. I always love this question. And you've been with APHA over 20 years. But do you remember when you first learned about public health, or first you really considered it as a career?
I don't remember exactly, but what I do know is when I look back on my career, starting actually in graduate school, my degree is in a field called social ecology, and my focus was juvenile justice, looking at juvenile justice from a multi-pronged perspective, understanding that nothing is happening in a vacuum, and that if we want to make a change, we have to think about it from the big picture. And so from there, I moved further and further upstream into work and activities that were more classically defined as public health. I was on the Hill for a bit. I worked for the American Cancer Society. And during each one of those jumps, I moved from thinking about health and healthcare and the outcomes to thinking about upstream, what can we make a difference to make sure that people are healthy? And so once I took this job, I looked back at my career and said, oh my gosh, I've been doing public health all along, but it was never defined that way.
Yeah. I think that's an interesting kind of aha moment feel, because a lot of us, especially hosting this podcast for so many years and asking this question, the majority of the time, people are kind of stumbling into public health, and myself included, didn't really realize it was an option. But once you do, it's like, oh, well, this is really what I wanted. You finally have something to articulate what you've been feeling and what you've been working for, really striving for. Tell us a little bit about the work right before you came to APHA.
So right before I came to APHA, I was working for a public health advocacy organization and doing some consulting. So I was working as one of the very early employees of Trust for America's Health, as they were just getting off the ground, and really bringing together the skills that I had developed to date as it relates to health and advocacy and understanding the government relations perspective, to the idea of putting all those pieces together and focusing on creating an organization that really did think about how to best interpret what public health is and advocate on behalf of public health at a time when we were much less controversial in a lot of ways, but still very much behind the scenes and talking about how, well, when we're doing our job, you don't know that we're there, to a time right now where we are front and center.
Right, right. Now, when you first came into APHA, did you come in with the role that you have now?
I did. I came into this role as the associate executive director. And like all things, I came in and I've been doing government relations work, and I'm doing so little direct government relations work. The GR lobbying staff is in my department, but I'm not the one who's doing that day to day. And so my portfolio, even though my title has stayed the same, has also expanded dramatically in those 20 years. I now oversee some of our meetings, like the Policy Action Institute. I'm much more involved in our annual meeting. We've been bringing up a couple of large nationwide alliances focusing on education and informing people about what public health is. The Alliance for the Public Health is to creating a social movement in support of public health, which is the Campaign for the Public Health. And so all of these things have happened in my tenure. They didn't exist before I got there, and now we are right in the middle of it.
Yes, yes, yes. Okay.
Well, the annual meeting obviously existed long before I got here, but the other things have been pieces that have been new since I've arrived.
Yes. That's really helpful to kind of see the picture. And even as I'm hearing you explain this, I'm getting a little like internal aha moments like, oh, that makes a lot of sense. Fast forward now to where we are today. I have some questions for you that I know won't throw you off your feet, but I am just curious. Given your history, what you just described, your journey to this point, I remember specifically right before the elections, and I remember being at APHA, I think we're in Minnesota, and I remember the conversations. In fact, I even delivered a conversation. I was a keynote for the Black Caucus Health Workers Award ceremony, and I was really speaking to leaders. And I remember everything around us was bracing us, everybody, the call for, voting, and then bracing for, what if. Did you think, given what we've gone through in 2025, is there anything that prepared you? Is it what you imagined? Is it beyond what you imagined? How does it compare?
It is so far beyond what I imagined. And I tend as a person to be generally optimistic, but I was not optimistic after the election. And as a matter of fact, my boss called me a couple days after the election and asked, how comfortable are you with risk? And I said, I am all in, because I knew that we needed to step up in ways that I had never done in my career before. And even with that as the mindset going into 2025 and through this point, I could not have predicted all of the different ways in which public health is a target, in which the core pieces of what creates a healthy community in a healthy country would be under attack, in the way that science would be thrown out the door, in the way that personal agendas would be so overpowering. I am still dumbfounded. I wake up almost every morning with a new level of, oh my gosh, when are we really going to hit bottom?
Yeah, yeah. I am, and I know that there has been so many fights. There's mountains of lawsuits, and it feels like when we win whatever victory we win for the moment, then it's like we'll get crumpled down. So it's like taking the step forward and then get knocked back 2 or 3 steps. Continuing to do this work, it's exhausting to say. That's not even really describing it accurately, but we're all, I believe those of us that are choosing to do this work are very called to this work and to this field. What are some of the biggest challenges right now? And this is to put into context, we're recording this at the beginning of March 2026. What maybe some of our accomplishments and wins, and what are the biggest challenges right now?
Let's start with some of the wins.
Yeah.
Congress passed a budget that was very different than the budget that was originally introduced, that put into place funding and support at levels that were much higher than we expected for some of the public health service agencies, including CDC. It included language in there, although whether or not they're going to just ignore it, about not completely reorganizing the Department of Health and Human Services without congressional approval. There are people who are now standing up to some of the, not even the worst, but some of the bad things that the administration is putting into place. But you're right. APHA is involved in 6 active lawsuits right now. I have been here for a long time. We have never had 6 active lawsuits at the same time.
Yeah.
And that is a place where we are seeing victory, although It's a slow and painful process, but it's because of those lawsuits that we've seen a halt on the rifts in the federal government, and that we've seen grants being reinstated after the cut to very early on in the administration when they stopped all grant money from flowing, and then grants being reinstated when they stopped all DEI grants from NIH. And so there have been regular opportunities for small victories, but this isn't even a full step forward. It's a half step forward because the process is so long. But we've also, it's almost a double-edged sword, for lack of a better term, because there are people who are standing up and saying no more. Public health is critical to keeping people and communities healthy. And you cannot continue to undermine in the way that you are. And so there are groups who are standing up. There are individuals who are standing up. We need to do a better job of being coordinated in that approach. So we're taking our limited resources and doing it in a more productive, progressive way. But I think that there's also a growing understanding that public health might be silent, but it is critical. And it's not just about COVID. It is not just about the issues of the last couple of years. It is about clean air. It's about clean water. It's about climate. It's about chronic disease. It is about tobacco. It's about violence. And people are beginning to understand because they are seeing impact in their community and around the world of what happens when the public health infrastructure isn't supported.
Yeah, absolutely. That's what's been, really surfacing. I mentioned to you, we have this series where we've been bringing groups of public health professionals together, and I'm asking the question, what is public health? Explaining this in plain language, like how are you explaining public health to your friends, your family, your neighbors? And we're collecting so many great stories where people are explaining public health in very relatable terms where people can start to see it and recognize it and understand this. Like, oh, I didn't realize that was public health. Those little grates on the side of the road. So if you hit them, it makes a loud noise. It prevents you from veering off. Like, that's a public health initiative. That's public health.
Right.
And there's so many stories and collections where people are starting to get plenty of aha moments and helping them to recognize that. And those are just so important in the work that we're trying to do in the advocacy space.
Yeah.
You mentioned PAI, Policy Action Institute, and I know that this is something that has been born since you've been at APHA. I first participated last year, and I even shared about that experience on this podcast. But can you just talk a little bit about what it is and how it got started?
So APHA puts on a huge annual meeting every year, and that annual meeting is anywhere from 10 to 14,000 people, and it really is about, among the opportunities to network and engage, but bringing forth the most current state of science in public health. And that's really important so that people understand the underpinnings of what public health is. The Policy Action Institute takes it one step farther, which is we all understand this is what the science says, but the Policy Action Institute talks about what it really means in real life situations. So what are communities doing? What are the policies that are happening in communities? Are there successes from these policies? Where are there obstacles or failures? And what can we all learn? And we talk about this in a much more conversational way so that people can leave and understand that there's a community in Connecticut that's working on gun violence prevention. And I live in California, and I can see some of the work that they did, the organizing, the steps they took to create a successful policy and then implement it. And so it really offers that opportunity to understand in a real world situations what's working and what's not. But in addition to that, no policy is any good if nobody ever talks about it or advocates on behalf of it. And so we build into the Policy Action Institute skills training on those two issues, how to be a better communicator in public health. We are so good at talking to ourselves. We understand our jargon beautifully. But I talk to my 95-year-old dad, and it's a different conversation. And so how do I communicate with people like my dad, who's smart and understands these things, but this hasn't been his life? And as we're moving forward, even more importantly, how do we talk to people who come from completely different perspectives and don't have a child who has spent 30 years in public health? And so it hasn't been something that they've drilled in. But how do we talk to Maha? How do we talk to people with whom we have common goals, but might have different answers to some of the questions? How do we talk to people who are in completely different places and thinking about the role of community versus individual? And so that's a really important part of the work of the Policy Action Institute, is to give people, both because of who they're hearing from and hearing what they did, as well as some direct training from experts at Johns Hopkins. How do we learn to talk about these things better? How do we learn to be better advocates? Because we have people from all around the country who come here in person, and it's a 2-day event, but the third day is an optional day when people can go up to Capitol Hill and actually put their learning into practice. And that is so important. All of us need to be better at that. And so it really does afford them the opportunity to hear what's going on and to learn how to make it actionable and to learn how to communicate it for people who are all across the political spectrum, because not every office in Congress or your state or local legislature that you walk into is going to agree with you. So how do we make it reasonable and understandable and compelling?
Yeah, yeah. That's a great description too, because that room, they're brilliant minds. You could almost hear the gears turning, conversations, sharing ideas across the small roundtable groups, and then the questions that were asked of the panels, the groups of speakers. It's a great experience, and the connections there, it feels like they're very lasting, because there are still several people that I met, engaged with, that I'm still connected with, and that's from last year. So let me ask you, I could ask you a million questions right now, but I really want to ask about our listeners. I know that we have a variety of people who listen to this podcast. We've got students on up to, early career professionals, and then the senior career professionals who like to, keep up with who's doing what. I also think, I don't want to speak for everyone, but just from my experience and conversations I've had, people are just all across the spectrum in terms of what to do and how to get involved. People feel like, I'm just going to put my blinders on and protect my space, and I can't consume all of this chaos. And then others are frantically trying to keep up with it. And some are like, I'm going to fight, and they're the first ones to make their signs and be in line. And there's just all the different, everyone all in between. What are some of the things that people can do to get involved? Some people want to get involved and not sure where. It may feel like, it's not going to make a difference because nothing matters. How do we do something? How do we take action? Like people feel very mixed across the board.
So I am a firm believer that in a lot of ways, advocacy begins at home, and it is ingrained. If you're a public health professional, you are by definition an advocate. And so if you end your advocacy by talking to your friends and family about the work that you do and help them understand what public health is, then that's great. And if that's what works you, then that's fine. I would push you to think about then taking the next step, though, because our public health folks who are on the front line, whether they be state or local health department in a nonprofit, they are academics, if they're students, if they're early career professionals in the private sector, we are everywhere. And we have frontline expertise that nobody else does. And we can talk about how to create a community that is maximizing its resources, how to create a community that is healthy. But to do that, it often means that we need to engage in the policy process. I often hear that public health shouldn't be political. And to that, I say that's garbage. Public health by its nature is political. We're not partisan, but we are political, because to do the work of a population-based approach, you need policy. It could be private policy, it could be public policy, but we need to engage in that process, which means that finding ways to understand where you're comfortable getting into that process. It doesn't mean that you need to understand exactly what every piece of legislation does. All you need to understand is what you do and what the impact of that is on people and communities. So you can walk into any congressional office and say, you need to support the Centers for Disease Control and Prevention programs much more broadly than you're doing now. And here's why. Because I work in a program that has federal funds, and we're able to work with this population and make this kind of difference in their life and keep them healthier, keep them out of the healthcare system, keep them out of jail, improve their education system. Whatever it is that you do, you are the expert in that. And that's all you need to know. So people are often afraid because they feel like they need to know much more than they do, but you know so much more than the people you're talking to do. And that's really, you just need to be comfortable in your own self and your own skin and your own work. So there are lots of different ways to get involved. We have very low bars at APHA. We have a letter that you can We send out an action alert. Any person, you don't have to be a member, can respond to that action alert. All it means to be at its lowest level is put your address, your name, your address in, and your zip code, and it'll go to the right people in the right committees. And that's a really low bar. But more impactful is to pick up the phone and call and talk to your legislators, or when you're in DC or when they're home, go talk to them, because the most important thing in policy and advocacy is developing those relationships so that they know a member of Congress's staff. And those are the people you need to talk to. Member of Congress is fun to take a picture with. And if you can talk to them, that's great. But if you talk to the staff, you are talking to the people who really are the driving force behind decision making. So talk to those people, develop those relationships. They will think about it when a piece of legislation comes across their desk and they can say, oh, I talked to this person from my district. Let me reach out to them and get their input. And if you don't know, it's fine to say, I don't know, but I can connect you with somebody who does. And that is the most important thing, being that liaison, being that frontline worker who can help members of Congress or city council understand the impact of the legislation that they are passing, because there's so many different pieces of legislation. There's so much pressure from different sides of any piece of legislation. And what you bring is the real world experience. And so I just encourage you to go outside your comfort zone a little bit. And if so far you've been comfortable talking at the Thanksgiving dinner table, next time try doing an advocacy alert. And then next time try picking up the phone when you get some information and say, let me tell you about what this really means on the ground to your constituents who vote for you.
I love that. And you have definitely pushed me a little bit each time we talk. So I've moved along, and I'm going to ask this question for myself. And I'm sure I'm not the only one who may be, in this situation. So let's say I have definitely moved along past, friends and family, and I've sent some letters. And I do love that resource, that tool that makes it really easy to put it. I've used that a few times myself, put in my information and send my letters out. I've made phone calls, and I've had some conversations, and I feel like I was being heard. I'm not sure what happened with it, but I've had some conversations, and I think that's been good. So in my state, I feel very much like I'm talking to walls. I mean, I do live in South Carolina. So part of me is like, well, let me just wait till after the elections, and then I'll, use my efforts. But I still send the emails. I will make the phone calls, but I don't get any further than that. Is that an okay way of thinking, waiting for past election and building new relationships? Or does it even matter?
It is always good to be aware that new relationships will be coming and looking forward to building those new relationships. On the other hand, no member of Congress, no state legislator, no city council member should ever pass a piece of legislation that impacts the public health and be able to say, I have not heard from anybody in public health. So obviously they're all fine with it. Even if they're not hearing you at that moment, if they continue to hear you, if they know that you are a constituent who's watching them and will be involved in voting or more, take a step up in fundraising for opponents, because the opponents seem to be more responsive to what's best for the public's health. That's something to take into consideration. So it always, always matters. And on the flip side, if you live in a place where all of your members are just 100% aligned, then it's important to thank them and to maybe push them a little bit and to remind them that they need to stay as champions because they are so desperately important to the work that we do. And it's so nice to have them. So it doesn't matter where they fall on the spectrum in terms of supporting the public's health. What matters is that they know that the public health community is watching.
That's really helpful. So what I'm hearing you say is my emails, even if they are not responding to me, they still matter.
They're counting. They're watching.
Okay. All right. I'm sure I'm not the only one, but that definitely helped me.
I'm sorry, this is not the first time I've answered that question. You are absolutely not the only one.
Awesome. All right. So I'm going to be mindful of time because we could keep talking about so many things. There's so many things that keep popping into my mind to ask you. So I'm going to think, what is my best question as we begin to wrap up? Okay, I'm going to ask you to share a bit of advice for anyone listening right now, public health folks. I've described the audience. What bit of advice would you like to share with anyone listening? I know that I asked you a lot of specific questions for me, but is there anything that you'd like to share, more broadly with people listening?
I think that we need to start being more comfortable talking to people outside ourselves. We need to figure out how to do that better. And it's not necessarily a skill that anybody learns in school. It's not even a skill that you learn if you do it over and over again. But take advantage of every opportunity to listen to people, to think, that was well done. What was it about that really made it compelling for me? And then use those skills. And communication in public health is so critically important because we have been overpowered in terms of our bully pulpits. And so what we have is, for lack of a better term, we have the white hats. We are not in it for the money. We are not in it for personal gain. We are in it because, as you said earlier, there is passion for people who are in public health. And so let that passion shine and take yourself out of your comfort zone. Talk to people who are outside, who are different from you. Talk to people who have the opportunity to make a difference in policy. Talk to people who have the opportunity to support your work and help them understand why now more than ever, people really need to turn to public health and to the work that we're doing and to support it all across the spectrum because we can't go away, but we are all exhausted. We are all beyond exhausted and we need help. We can't do it alone. So move across the aisle, talk to non-traditional champions. There are PTAs, there are transportation experts, there are justice experts, there are people who focus on racial equity. All of these folks are part of our coalition. So let's figure out a way to work together, to work in a productive, compelling way, and to get our message out there.
That's wonderful advice. Susan, thank you so much for taking time to talk to us. I will add here, I think this is just I am putting in a plug for PAI. So this episode will be released in, I think, mid-April, according to our plan. So if you're listening to this episode and it is before the Policy Action Institute, it's every year in June, right? So
Yes.
If you're able to make it, I highly recommend you do so. It's an incredible opportunity, experience, and will be very rewarding if you have any inkling, anything rising up in you that's like, I want to do more, I want to advocate, but I'm not really sure, I have questions. This is a great place to be. And we'll make sure that we have links in the show notes so that you can get all the information and register.
Registration will open in early April.
Okay.
And we'll start putting names up on the website in the next probably couple of weeks of our speakers. It's www.apha.org/PAI. And that'll take you right to the page. So
Perfect.
Please, I'm looking forward to seeing you all here.
Yeah, I really highly recommend it. Thank you so much, Susan. I can't wait to see you at our next, we cross paths multiple times a year now, so I will see you again really soon. I appreciate you and everything that you're doing.
Charlotte. Thank you. Thank you so much for this opportunity.
I really hope you enjoyed that conversation as much as we did. Advocacy doesn't require a law degree or a perfectly crafted speech. It requires knowing your work, knowing your community, and being willing to show up. This conversation is a reminder that public health professionals carry frontline knowledge that no legislator has, and that knowledge is powerful. Whether you're sending your first action alert or building relationships on Capitol Hill, your voice is part of the infrastructure that keeps communities healthy. You don't have to be everywhere. You just have to be somewhere. I hope you will consider attending the Policy Action Institute. I have a full episode where I share about my experience at PAI in 2025, and I will provide links to that episode in the show notes. I think it will be helpful for you to listen to that episode if you're considering attending PAI. I also encourage you to connect with Dr. Polan and learn more about the great work that she's doing at the American Public Health Association. When you reach out to her, be sure to let her know that you heard her on this episode. You can find the links to connect on the show notes page. The show notes page for this episode, which is episode 453, can be found at phecpodcast.com. Once you're there, just navigate to episode number 453 to find its show notes. One more thing before we go. Remember that our podcast has an app and a private community independent of social media platforms. This is where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download the PHEC Podcast Community app in your mobile app store and is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.